Hey, what's up? Dr. McGowan here at True You Weight Loss in North Carolina. And I thought I'd take a couple minutes to give a quick tour of our equipment. So many people wonder what is all that stuff behind us during procedures. So let's have a quick look and I'll explain what all of this is. All right, so all of our procedures are performed endoscopically, so the heart of the system is our Fuji endoscopy setup. So this is the Fuji 7000 series processor and light source. So we connect our endoscopes to this device, and what this does is powers our endoscope, allows us to see within the digestive tract, and it provides high definition video, which is really, really important. Now, during the procedures, the video from this endoscope is projected onto a monitor across the screen, which is what I'm looking at when performing our endoscopic procedures. But the video is also transmitted here to this device. This is called the ConMed Touch Glass system, and you can see right there, the video is projected there as well. Now that video is actually stored. That allows us to store photos and still pictures. We also record every procedure in its entirety and then store that in the cloud. That's useful for future teaching purposes, and sometimes patients want to see their video as well, and we can share that. This also allows us to stream video live. Now that's really important for education if we're teaching a course, but also it allows us to transmit video between our different centers. So if there's ever a procedure we want to jump into virtually, that can be broadcast real time. All right, next, so let's pan down a little bit here and take a look at a few other components of our setup. So here we have two devices. These are carbon dioxide or CO2 insufflators. On the right is a standard insufflator. This is made by a company called Palier. This is the EVA 5. And on the left is a much more advanced system called the EVA 15. So this is an insufflator that also regulates pressure, and we use that during some of our most advanced procedures that involve mucosal ablation, where we can set a precise pressure and the system will regulate that so the stomach is kept at an exact level of insufflation or inflation, which is really important during those procedures. All right, the next thing below that we have this water pump. That's what we use to flush clean water through our scope. It's how we can rinse the stomach during procedures, and that's a key component as well. Below that, we also have an additional CO2 insufflator just as a backup. All right, so the next device we use is called the Herby device. This is basically an electrocautery device, a really advanced one, and it has multiple components. So we use this device anytime we need to apply heat within the digestive tract for cautery purposes and also for ablation, which is a big part of many of the studies that we have ongoing here at TrueU. So this has several units. It has the main component, which is the Vio 3. We have the APC3, which is how we provide argon plasma coagulation within the digestive tract. And then we have what's known as the Herby Jet. Herby Jet's a great name, and this allows us to basically inject a high pressure jet of fluid into the lining of the stomach, for instance, to lift the lining up prior to ablation. Again, this is an advanced technique we're using in a couple different studies that we're performing. So these are all of the components, most of them, that we use during our procedures here at TrueU for endoscopic bariatric therapies. So if you have any questions about that, put them in the comments. I'd be happy to answer or provide further information as well.